it's Patricia here. Thanks very much for joining me for this interview with Andrew Scarborough. The first time I met or came across Andrew was on a Twitter chat actually, and we were talking about individualized protocols of the ketogenic diet. And I was very intrigued, to say the least, by his very unique and unconventional approach to the ketogenic diet, but even more impressed by the results he's getting. And as always, if a cancer patient gets extraordinary results with treatments that aren't quite conventional, there is usually a lot of media attention, and that's what happened to Andrew as well. So both Andrew and I, we were very keen to clarify a few things, especially with regards to his diagnosis and with regards to the use of the ketogenic diet as well, and whether this is a suitable approach for absolutely everybody. And because it is a controversial topic and the media like to jump onto controversial topics and to make it their own, we hope we clarify a lot of things in this interview, and I'm sure you're also going to learn loads and how to incorporate certain really nutrient dense foods into your own unique protocol and approach. So how are you doing? Did you have I saw you had another interview yesterday.
Yeah, that was kind of interesting.
Tell me
They
about
kept
it.
saying the word cure, so
Oh no, yeah.
it's an interesting kind of area with just terminology and media, radio stuff, articles as well.
Mm.
Just it's they need to have a story, so
I know,
it's
that's it exactly. It's sort of sensationalism a little bit as well, I think.
yeah, it's a good thing and a bad thing because it raises awareness, and it raises awareness of what I'm doing as well,
Mm.
which has huge potential, but you can't really say anything definitive. So
Yeah,
um, it's an interesting area of discussion,
yeah,
definitely.
definitely. Yeah, but I think it's always it's good to clarify. I mean, when people say, "Oh well, are you completely cured now?"
Yeah,
Yeah, I guess I am because my tumor is dead, but it
yeah, that's
it's
true.
always
I'd say the aim for me is definitely, even though it's like an ambitious aim, if you know a lot about brain cancer, the aim is cure, but we know that there's no known cure, so we need to have more clinical trials for people doing, what we're doing, and
mm,
that only comes from awareness. A brain hemorrhage after a gym session in April 2013,
all right.
and that could have been fatal in itself.
Yeah.
And then I was rushed to hospital. I had many tonic-clonic seizures, and they told me that it could have been either an AVM, which is an arteriovenous malformation, which is quite a serious, life-threatening thing.
Yeah.
And then they said, "Oh, it actually maybe it looks more like a cavernous hemangioma, which is a massive abnormal blood vessels in the brain that you could actually, if it's asymptomatic, you could leave it in there for for the rest of your life. But if you continue having seizures, usually they um, would attempt to remove it, and then you just go on with your life, and it's all rosy and happy. But Yeah, there was so much blood on the scan that in the brain that they couldn't really tell what was going on. But then I kept having tonic-clonic seizures very frequently, and even then on the NHS, I could only have if I wanted an operation, I could only have it 8 months from from that point.
No way. Wow, is it
Yeah,
just such a long waiting list, or?
it's just that they treated it as a very benign thing because it was misdiagnosed.
Right. Okay. Yeah.
So I ended up actually going private and then having the operation because it was causing me just these, these horrific. I was having these horrific symptoms where I just had facial paresthesia. I had so many injuries from the seizures I was having, and I would go unconscious for long periods of time.
Wow. Wow.
So yeah, it was a good idea to have the operation when I did.
Yeah, definitely. Yeah. Yeah. I mean, it's
And
always, I think the private public system,
yeah,
I went private as well afterwards. Yeah.
yeah, it's a shame, really. But then my neurosurgeon said, yeah, if we knew what it was initially, yeah, even on the NHS, I would have had that that surgery as an emergency
Yeah.
because it was yeah, malignant, and there was some disease that they couldn't remove attached to the motor strip in my brain. So
Right. Okay. Yeah.
yeah,
So, and then 6 weeks later, you got the phone call after the operation. So you thought everything was fine and the symptoms were gone, or was there still quite a lot of symptoms after the operation, I guess, as well?
yeah, I was still having seizures after the operation for quite a while. And I was on they put me on a huge amount of different epilepsy medications, which had their own very debilitating symptoms. I was also on codeine, morphine, Oromorph,
Wow. Yeah.
and just paracetamol as well. So I was on just loads of drugs. So I actually became quite dependent on those painkillers too, which had their own problems. So
Yeah.
coming off all that was a huge struggle, but I wanted to do that because I hated being on drugs anyway. So yeah, I was told over the phone about just how I had this thing that was they still didn't know how to define it, but they told me it was I would have to have chemotherapy and radiotherapy, and that my tumor was they told me it was a tumor and not a cavernous hemangioma, which was a huge shock to me, because even on the discharge notes after my operation it said cavernous hemangioma. So I was just really shocked that they told me over the phone it was something that was actually a malignant brain tumor and was it was incurable but treatable, and I didn't quite know what that meant. They kept saying palliative, so palliative care. So yeah, I didn't know much about. I was quite ignorant, really. I didn't know much. Well, quite naive. I didn't know much about brain cancer apart from the little bits I learned when I was doing my master's in nutritional therapy.
Yeah.
So I only touched on it briefly, but also because I had no disease in my family before that, I just thought, oh, something like that wouldn't happen to me, especially studying nutrition and being so, having worked as a personal trainer as well. It was a huge shock. But I I did a lot of research into long-term survivors just almost straight after I got over the shock, which
Great.
it took about an hour of thinking, oh my God, I'm going to die. What's happening here? To just trying to take action and do something about it. So I contacted just a load of long-term survivors who I tracked down from various news stories, and I looked into just because I'd studied well, must have been around 6 years of nutrition in total.
Yeah,
I had the analytical skills, luckily, to see what's good and bad on the internet.
yeah, exactly. That's quite an art, isn't it?
Yeah, exactly. You need to kind of learn a lot about neurology, and also just oncology yourself to to actually take control and understand these very complex, I don't know how you
The
describe it, but
terminology as well, I think
processes
that can
in,
be, yeah, and
all
the,
the jargon that they use.
I know, yeah.
But yeah, once you understand it, it's quite interesting. So I
Mm.
actually, because I didn't understand, I was still learning, I went ahead and had radiotherapy and chemotherapy for a while.
Mm-hmm.
But I was constantly having dialogue with my oncologist, just asking about the pathology of the tumor, and he said that it was unlikely to respond to chemotherapy at all, because it didn't have any of these mutations which are deemed to be preferable to have.
Yeah.
And my tumor was highly vascular, so we didn't know how it would respond. It's not usually a good thing to have a constant blood supply giving
Yeah.
nutrients
Yeah,
to
exactly.
the tumor to help it to grow. So
Mm.
I decided after a while to stop having the chemotherapy, which was kind of against the advice that I was given. And then I decided to transition onto a ketogenic diet, which I found very difficult at the time, just because, well, very fortunately, I wasn't on steroids
Okay.
for
Yeah.
brain swelling, which was a big positive.
That can put a big spanner in the works. Yeah, definitely.
Yeah, and I know so many people who have been on the steroids, and they're not really aware of how the treatment affects them, because they're it's they're just, it kind of takes away the tiredness that you experience if you're not on the steroids. So
Yeah.
I was extremely fatigued, so I could understand just what was happening in my brain from this toxic treatment. So just that, and the fact that I was told that uh, the pathology of my tumor suggested that treatment wouldn't have any real benefit to me, and it may actually make things worse, may cause more gene mutations. I decided to cut my treatment short, especially since the suggestion was for me to have chemotherapy for up to 2 years, which
Wow,
is
it's a long time.
really
Yeah.
long time.
Yeah.
So yeah, I chose to quickly abandon that. Fasting, which I did for a while, but then had problems while being on all this epilepsy medication with the fasting.
Yeah, I'd say
So
so.
yeah, I did that just as an intermittent fasting, but then I was still having problems. I was having breakthrough seizures just from drug withdrawal and
Mm.
from just, I guess, as a reaction to lowering carbs and becoming keto adapted.
Yeah. Yeah.
But then every time that I'd reduce the medication, I'd have a withdrawal effect where my symptoms would get worse before they got better.
Yeah.
And even though it was a terrifying thing, I just persisted with it because I thought, well, there's no other real. I was just very determined to do something. So
Mm.
I knew that if I didn't do anything, that if you follow the standard treatment, you'll get the standard responses,
Response.
which is
Yeah.
you'll feel like a zombie being on all this medication for epilepsy where you can't even go out because you're so fatigued.
Yeah. Yeah. And
And it
that's often the
causes,
question, I guess, with treatments as well. I mean, it's one thing curing cancer or managing it, but the question is, what's quality of life like? I think for me, that's almost, or personally, that's almost as important as, if treatment works, and it's just the quality at the moment as well. And if you get cured, but your quality of life is really, you're so tired, or you have a lot of side effects. I mean, I know it from myself. After treatments, the eye was so badly affected. I didn't have any balance, so I couldn't do exercise as I wanted to.
yeah.
And I poured, when I wanted to cook, I poured everything beside the pan. And I was just saying, wow, that's it took me a long time to adapt to that, and it wasn't the quality of life that I'm used to. So I guess
Mhm.
if you're a bit ambitious, and you really want to have a good life, you want to exercise, and you want to feel
Yeah,
well
I
and
was
healthy.
extremely active before, and I
Yeah.
couldn't even. I struggled to just walk from one side of the room to the other. I was bedbound for months.
Yeah. Oh yeah.
Um, so, yeah, and I was having speech arrest as well, where I could either think of the words but not get them out, or I could get words out, but then I'd forget. I forget the words, and I couldn't think about what to say. So yeah,
Yeah.
just
So
actually,
yeah.
yeah. So I continued with restricting my carbs on this ketogenic diet.
When did you start, actually? Sorry, when did you start the ketogenic diet, and how long did you have chemo and radio beforehand?
Okay. Well, I had the standard 6.5 weeks for high-grade glioma uh, of chemotherapy and radiotherapy together.
Hmm.
But then I was supposed to have cycles after that for up to 2 years. And
Okay,
I decided to stop after 3 months of
right,
that.
yeah. And do you
Um,
know if, actually, in terms of scans, do you know if it had any effect, the chemo or radiotherapy, or was that, were they able to
well, the
tell?
interesting thing about that is that there was actually signs of enhancement coming up
Oh goodness.
uh,
Yeah.
after after my chemotherapy and radiotherapy, um, and before I continued on to the cycles that I had. So that seemed to actually be getting a bit worse. So
Yeah, so that makes a decision to really
yeah, a lot
drop
easier.
convent. Yeah,
Um,
definitely. Yeah, yeah.
but again, we know that these scans, you can't really tell much, especially because at the time I was having less detailed scans than I have now. So one of
Mm.
the big things that I'm working to do with my local MP is to try and get better scanning equipment in all hospitals.
Yeah,
So I'm at Charing Cross Hospital at the moment, where they have MRI spectroscopy, which is a much more detailed type of MRI scan to what I had at the Royal Marsden, which is
right.
kind of grainy and you can't really see much detail.
Mm.
Uh, MRI spectroscopy also looks at the the environment, the microenvironment as well, just to look for biomarkers of you could possibly detect cancer progression just by looking at certain things like elevated levels of choline and in the brain, and it's just really around the tumor site. It's just really interesting looking at that
So
research.
do they have that type of MRI then in a lot of hospitals, or is that mainly now
No,
where you are in Charing Cross?
it's only very few in this country, so it's quite worrying in a way, just the huge variation in care from one hospital to another.
I know, tell me about it. Yeah.
So one of the things I'm aiming for is my oncologist recently offered me work as a patient advisor, and also at Charing Cross Hospital.
That's fantastic.
And also he wants me to work in the lab alongside individuals at Imperial College London. So
wow,
that's quite exciting to be able to.
Congratulations.
Thanks.
Brilliant. Yeah.
So that'll probably be in September. I'll be starting that because it's part study. So I didn't get to complete my master's. So I get to do some work in the lab, which is quite exciting.
Great. Yeah, and then you can finish your master there and sort of go completely ketogenic.
Yeah, definitely. Freed this almost 2 years ago now, after my diagnosis, and he just gave me loads of resources onto just got me in contact with Dominic D'Agostino and Adrienne Check, who are at the forefront of this kind of research. And then I got the book Keto Clarity, which is kind of a very basic way of helping you to understand all this stuff, which I would suggest any brain cancer patients or anyone with any kind of neurological disease or disorder, if they're starting on a ketogenic diet, it's a really good resource to help them to understand the basics of it.
It's Jimmy Moore and then Dr. Westman as well.
It's just very easy to understand in layman terms.
Great, and I guess also Perlmutter's work, Grain Brain and Brain Maker, those are very helpful too, I guess. But definitely. It's more about obviously the brain, just focused on the brain and not necessarily keto.
Which I think personally that it should go beyond ketosis anyway. There's a lot more going on, which that can kind of be ignored. People are sometimes focused too much on numbers and just being in ketosis, which initially that's the mistake I made. So when I went on a traditional ketogenic diet, I actually failed miserably. And I didn't realize at the time that I just had lots of food intolerances. So eventually I learned that I was very sensitive to salicylates in my diet. So
which restricts you a lot, in terms of vegetables and nuts.
Exactly.
Exactly.
and get into therapeutic ketosis for cancer management without any problems, then that's a good thing to do. But when I explain my diet to cancer patients and to the media in particular, people immediately think, oh, well, I have cancer, so I have to do everything that Andrew does, you know.
Yeah, and
which,
I think that's exactly the danger as well, that people just follow something and that they hear about, oh, such and such did this and this, so I'm going to just try it as well, and then they mix and match, and it gets completely overwhelming, and obviously they don't get any results either.
Yeah, there's evidence to suggest that some of the things I do may have a lot of benefit for people as a whole, but it's unknown. So I'm experimenting and trying to have an optimal ketogenic diet for myself. So yeah, over the last couple of years, I've adapted my ketogenic diet while very gradually lowering my epilepsy medication, which I was advised against. I was actually advised to increase my medication. And I didn't realize at the time that a lot of the lethargy that you get from certain epileptic drugs, especially Keppra and Epilin, which is what I was on. A lot of the lethargy that you get from that is actually caused by the micronutrient deficiencies that you have as a result of taking these drugs.
That's right. Yeah.
Which are not explained by neurologists who I saw 5 different neurologists, and they didn't know much all about nutrition, which was quite disappointing, really. But I now see one who is in the team at Charing Cross. They have a fantastic team, and they immediately understood what I was talking about when I said about the magnesium and calcium deficiency that you get as a result of being on high doses of these medications. So I started to adapt my ketogenic diet by having more bone broth, which, you know, it's very good for giving you the potassium and magnesium and
for healing the gut as well. I
and
mean, you probably developed quite a lot of food intolerances through the chemo as well. I see that a lot.
Yeah, and just having an acquired brain injury as well just makes you more sensitive to certain foods. So another thing I do is try to keep my omega-3 to 6 ratio as close to 1 to 1. I believe that it has all the components that my brain needs to thrive. You know, it has the DHA. Your brain is made around 20% of the fats in your brain are DHA. So
that's an amazing source. Yeah, exactly.
It's a good thing to have.
And
I looked into research into Alzheimer's as well, and it was really interesting how there's a component that's found in cows' brains that they have used in pill form in some studies into Alzheimer's, and it's helped to slow down the cognitive deficits, and in some cases reverse some of the issues that are. I don't have to count my carbs, which is a really nice thing. So I just count my protein and fat intake, and I can't have coconut oil because it's high in salicylates.
Yeah, and avocados as well.
I can't have avocados as well. So most ketogenic diets are based around those foods. So how I get around that is I have lots of ghee, which is clarified butter. And that has a good amount of MCTs in it, the mixed chain triglycerides, which are what we're aiming to get lots of on these ketogenic diets for cancer management in particular, because your brain can use it very quickly for energy, kind of like it would use carbohydrates. And another thing that I've done recently is I've come off my epilepsy medication completely.
Wow, great.
Which I was told would be impossible by 5 different neurologists. So I came back to one of them and just said what I've done, and they said, "Oh, that's really interesting." because he was concerned about my blood cholesterol when I went to see him last. And he had me do a blood test, and my HDL cholesterol was above optimal levels, and my LDL had gone down. And I take that out, or I make
keen to try it then as well, or does has anybody else, have they said, oh well, can I try a little bit and have a taste?
Yeah, my girlfriend reluctantly tried it.
Great.
And,
Yeah.
she actually found it tolerable, but she found it a bit weird. She didn't know what to make of it.
Okay.
But I've made it with duck eggs recently, and it seems to taste. It gives it a different kind of taste. It's kind of a nutty, kind of richer taste. So I use duck eggs a lot now because they just have bigger yolks. That even if it's a comparable size to a chicken egg, the yolks tend to be a bit larger, and it gives it just a richer taste. And I think just I like having that extra fat, and
definitely. And I think a lot of people actually who are egg intolerant, like me, I am quite sensitive to hen's eggs, and duck eggs are a lot easier to tolerate, or I just don't have the same symptoms. So I most of the time I just have it about twice a week anyway, because there is this sensitivity, so I don't want to overdo it, but I tolerate them a lot better as well. So that's interesting that you using them quite a bit as well.
noticeable.
Wow.
So I
Great.
would start the day with that at 9 a.m., which is when I used to take my medication.
Mm-hmm.
Then I wouldn't be hungry until about 12. So at 12 today, I will be having my usual breakfast, which is scrambled eggs and lamb's brain, which is about that big.
Okay.
It actually gets bigger once you after you've removed the membranes through boiling it and then leaving it and then
Okay.
cooking with it.
So do you chop it up and make like a little sort of a stew and just fry it, or how
Yeah,
do
I
you
do
just put it in
differently every
whole?
time. So
Okay.
often I have it mixed with scrambled eggs.
Mm-hmm.
So it gives the scrambled eggs a kind of a creamy, saltier taste to it. So you don't need to add salt because it naturally has sodium. So I very rarely add salt to my foods just because the the keto force has sodium in it, and the brains have sodium, and then I just add a little bit of sea salt to oily fish. So
Mm.
every day I would have for breakfast at midday I would have scrambled eggs and brain, usually as a typical meal,
Mm-hmm.
and I would mash in 40 grams of ghee. So that meal is around 60 to 70 grams of fat, and at least I'd say around 25 grams of protein.
Mm-hmm.
It's all measured out to what works for me as an individual. Then around 3 o'clock, I would have, well, throughout the day, I would be drinking bone broth as well,
Okay.
just when I get thirsty
Mm-hmm.
instead of water. That's usually what I have. But sometimes I do just have water. And then around 3, or I would have, I make a kind of a pizza with, which is just, it's usually 2 eggs, usually duck eggs, mixed with ghee as well.
Mm-hmm.
And then I add 70 grams of streaky bacon, which I make sure it doesn't have added sugar or any nasties in it,
Yeah.
because you have to be very careful with that. Even with meat, often things are added to it. And I would just stick that in the oven after mixing it all together for 25 minutes, and then put it in a tray where it kind of molds it into a kind of pizza shape.
Mm.
So
That's nice. Yeah.
because it's so fatty after you've cooked it,
Mm.
you kind of leave it to cool, and
Yeah.
then stick it in the fridge for a short while, and then it comes out, and it's like a pizza, because I also add Mediterranean herbs to that, so it
Okay. Great.
actually gives
Yeah.
that kind of Italian taste.
Brilliant. Yeah. So are you
And then
okay to use herbs and spices?
in
Uh,
little amounts because of the
okay.
salicylate
Yeah.
sensitivity,
Mm.
but usually I have things like turmeric, which it's anti-inflammatory, and
Yeah.
it has anti-tumor properties. So I have turmeric. Sometimes I have cinnamon to help lower blood glucose. I'm thinking of experimenting with mushroom extracts and odorless garlic and
Mm-hmm.
uh, resveratrol as an anti-inflammatory for the brain.
Yeah.
So just I'm still experimenting and learning lots of trying to adapt and learning new ways of optimizing this diet.
Mm. Yeah.
Um, so for dinner, typically I would have just some type of oily fish. So I'd have mackerel or sardines, salmon, fresh from the fish counter.
Yeah.
I just ask lots of questions about it as well,
I
so
know. Yeah.
they
Same
find me a
here.
bit
It'd be
annoying,
annoying.
but it's
Yeah.
good.
I know.
So yeah, that's typically what I would do. But usually, often for my lunch, instead of that pizza, I would have a type of organ meat. So I would just alternate. So one day I would have sweetbreads. One day I might have well, I'm experimenting. So my next thing I'm trying is lamb fries, which is lamb's testicles.
Okay.
So that would be interesting because I
Yeah.
haven't tried that and I'm a bit squeamish about it. I'm also experimenting with trying different insects. So for that lunch meal, I might, instead of adding the bacon, I might add things like wax worms,
Okay.
which
And where do you get them?
I have a local, well, I say local, it's in Bristol. There's an insect farm in Bristol where you can get
Right.
a number of different insects. And waxworms and beetles are the fattiest kind of insects. So they're good for a ketogenic diet.
Interesting. Yeah.
It's just difficult working out the ratios of fat and protein, but it's interesting with insects because you're eating the whole animal, so you're getting a variety of nutrients there. And if you look at indigenous populations of certain countries that have low rates of malignancy, they were eating insects as their primary protein source, along with these organ meats. So and they, as we discussed earlier, they understood the health benefits of adding these foods. So
but I know there's still, when I was traveling in Asia, it's still quite common as well. That what they sometimes do with them, like deep frying a lot and all of that, that's obviously questionable, but it's still part of their diet. And I think here we're just so squeamish about anything. I mean, organ meats, whenever I tell people to start incorporating that, because also if you watch an animal kills another animal, they don't eat the muscle, they eat the heart.
The first thing they go to is normally a predatory animal, is the organs, and typically it'll be the liver first, because that is just, they instinctively know
it's nutrient dense,
the most beneficial nutrients.
And heart is actually nice as well. I had some beef heart the other day, and it was good.
Heart, interestingly, is a fantastic source of coenzyme Q10, which people pay a lot of money to get in these pills. So it's just crazy how,
I think, because nobody buys organ meat here, it's so cheap. That's what often people say as well. So how do you afford all these foods? It sounds very expensive, but organ meats, they're just, because there's absolutely no demand. A lot of farmers, I know, they just throw them out.
A lot of them I get for free, and it's just crazy, but it benefits me, so I don't mind.
Well, that might change.
But the interesting thing is, where I live, if you went across the channel to France, you'd pay a lot of money to eat brain in a French restaurant. It's a very chefy food. And even if you go on YouTube, there's videos of Gordon Ramsay cooking with brain and sweetbreads, and Hugh Fearnley-Whittingstall, and there's Gordon Ramsay, there's Heston Blumenthal cooking with brains, and it's just really interesting. It's a very chefy food, but it's something we used to eat a long time ago, but there's kind of this, people are squeamish about it now, and it's the leaner cuts are more,
it's all because of the low fat guidelines as well, I guess.
Definitely.
People just want chicken breasts and some lean cuts of lamb and beef, and that's pretty much it. But I really hope that'll change again. I mean, it is slowly becoming a bit more mainstream. Okay, fat is okay.
Definitely. And it's quite encouraging, I think. And,
it's not a nutrient of concern anymore, and so, as they call it. a few really absolutely mind-blowing results with clients in terms of brain cancer, and just the latest was a 3.5-year-old girl, and she was diagnosed when she was 6 months, and she had lots of chemo, and that sort of it worked in terms of it got rid of the metastasis that she had, and it kept the tumor stable. But then I think it was at the beginning of this year, the scans changed again and there was more activity. The tumor started to grow again, and they didn't want to do more treatment. I mean, she really needs a break and probably wouldn't tolerate it at the moment. So we started keto in March, towards the end of March, and 2 months later she had a scan and it's stable. It's stopped growing, and the great thing is as well, we were talking about it earlier about quality of life. Her mom said she's just, in general, her eczema is gone. She has regular bowel movements, which she never had before. And we worked on her vitamin D levels as well. They were totally floored. And her mood is obviously better. She sleeps better. And so it's just, all in all, she put on a little bit of weight, which was great, which she hadn't been able to do before. And she's just much happier and in more energy and better form, which obviously is, the mom said, even if it's just that
as well. I've had just huge changes in what I'm able to do. I feel almost 100% as I was previously, which is a huge thing. My last scan showed no disease, no enhancement, no increased blood volume around the tumor sites, just a very tiny amount of scar tissue, which is only a few millimeters, which has healed dramatically over time, and just the symptoms of the seizure activities are just completely, when I'm in my therapeutic ranges of ketosis and with the lower blood glucose that works for me as an individual, I have 100% control of my symptoms, which is just, I still find it quite remarkable.
That's unbelievable, really.
But it's definitely working. Anti-inflammatory agents and compounds. So it's a drug cocktail that seems to target the same pathways that a ketogenic diet would. Which is it's very interesting. I had his book, and I also know that he was it's quite interesting. He was he went and had tamoxifen with his alongside the standard chemotherapy that's
interesting,
proved to be ineffective for brain cancer. But he did some research where the tamoxifen may have a beneficial effect on the tumor, and it seems to have we still don't know if it's all the other stuff with the drug cocktails that he that had the response where the inoperable tumor shrank to nothing, or if it was the tamoxifen or the combination of the two. So
yeah, that's often the problem, isn't it?
yeah.
What works? Is it the combination or a single compound?
Yeah.
Mm.
My theory would be that I think it would most likely be the combination of all of it, that all of the things that he did.
Exactly.
Because I know that in animals, even a restricted ketogenic diet only prolongs survival. It doesn't have these miraculous cures. So I'm very interested to see, even just with my own experiments, what happens with me experimenting with my own version of a ketogenic diet and all these anti-inflammatory methods of what I'm attempting to do. And I'm trying to get hyperbaric oxygen therapy for myself
I
as
was
well.
just going to say, that's that can be extremely effective in combination with the ketogenic.
And we know that in the mouse models, these tumors can completely disappear and not come back for a mouse's whole life expectancy. With a combination of the restricted ketogenic diet, hyperbaric oxygen therapy, and what's the other thing?
And
keto
and the supplement.
Well.
Yeah, exactly.
So that's the one thing that I'm attempting to add to my program and to get more acceptance for. I don't have any visible tumor there, but I know there may be some microscopic cells in that area left where there was residual disease. So
right, okay, yeah.
I'm keen to see if I can. I would never say cure, but I think that certainly I believe that this disease can be managed indefinitely.
Exactly. Yeah.
I think management is the key term here.
Yeah,
that we need to use.
Exactly.
Because we have no idea of, if someone was to go off this kind of restricted ketogenic diet, if the tumor would just, immediately come back. Because
you don't want to try that, obviously.
No.
But I have heard, anecdotal evidence that that's what can happen quite easily. That somebody's doing really well on the ketogenic diet and they think, okay, great, I go back to whatever I was doing before for whatever reason, and it came back quite quickly. But obviously you can't do any ethically acceptable trials with that, so it's just based on assumptions. But I do think it's very much a multidisciplinary approach. It's not just ketogenic, and that's what people have to understand. I think it is a lot of work. I mean, exercise is absolutely crucial as well, I think, and the whole emotional aspect as well. I mean, that's something I'm constantly working on as well. I know that there is an emotional component to my illness, and I think in most cancer patients that's the case, and stress management as well, all that. And actually in the University of Kansas, I was listening to a really interesting interview recently. They do a combination of intravenous vitamin C, low dose chemo, ketogenic, hyperbaric, and all that. They combine and they have absolutely excellent results. So that's, I think it's all these different components, that then can make all the difference.
It's definitely that kind of cocktail approach of treatments. It's controversial, the drug area, even though some have had success in it. But because I believe that with a ketogenic diet and just increasing ketones in the blood, maybe through supplementation alongside that, and this oxygen therapy, it's been shown with KetoPet. We need to show it with, which is the the dogs with cancer who are treated in the US.
Yeah, I know.
Which is really interesting to follow.
Yeah.
It's been shown with dogs with brain cancer, and interestingly, dogs get more brain tumors than humans.
Oh, I didn't know that. Yeah.
I think you could suggest maybe that's because we're feeding the dogs with wheat and man-made
Exactly. Yeah.
materials rather than
Yeah.
the standard diets. But
Yeah.
that's a discussion that's
Exactly.
controversial somewhat. But with the dogs, the tumors, you can follow them. It's really interesting. They seem to just completely disappear with this kind of treatment of different modalities combined, which is I find that very interesting. So I'd like to see that with humans.
Yeah. And I guess the whole drug cocktail thing, it really is for people who just can't possibly have the discipline and the willpower to follow a ketogenic diet.
I would say also if they have very advanced disease, so they don't have time to adapt onto a ketogenic diet. I think a drug cocktail treatment would be more efficacious and more useful in that scenario.
In that case, yeah, exactly. But obviously you always then have the side effects again, which you have a lot less with a dietary approach. So
yeah, I would see it as a short-term benefit, and then ideally they would go on to a ketogenic diet.
Transition on. Exactly. But it's a fascinating topic, and I'm delighted that you're going to do all this important work, and that it's a fantastic opportunity.
I'm looking forward to it very much. I'm seeing my neurologist in a couple of weeks to talk about it as well, so
brilliant.
We're going to move forward with things as quickly as possible. So
so it's great that it's a multidisciplinary approach. I guess that's just fantastic, and having both complementary and conventional aspects then integrated. So
definitely.
Brilliant. So great. I'll let you go and have your brain.
Yes.